At a time when everyone is looking to understand the scope of the pandemic and how to minimize the threat, one of the best informed voices is that of businessman and philanthropist Bill Gates. The co-founder of Microsoft has spent the last few decades focused through the Bill and Melinda Gates Foundation on improving global health, including reducing the spread of infectious diseases. We spoke earlier this evening. Bill Gates, thank you very much for joining us. You were one of the prescient few years ago who said that an infectious disease outbreak was coming that could kill millions of people. How is what is happening now different from what you expected?
Well, sadly, I would say that the economic damage is much greater. I put $3 trillion for a respiratory virus spreading around the globe, and clearly we're going to go well beyond that. The whole goal of speaking out then wasn't to be able to say "I told you so" when it happened. Rather, it was to make sure that we did the right things so that diagnostics would come out right away. The timeline for a vaccine would be very short. And sadly, not many of those things were done. So we're scrambling to come up with therapeutics, scrambling to try and figure out how to get this vaccine made. But people are rising to the occasion, but it's a very bad situation.
Well, speaking of things that weren't done, testing. This has become one of the central problems facing the United States right now. President Trump said, I think 3 weeks ago, that there would be some sort of rapid testing. He mentioned Google. He said that was imminent. It hasn't happened. Why is this so hard? And what do you think it's going to take to get a rapid turnaround test in place?
Yeah, we need a variety of tests. The testing that's currently being done, which is a PCR-based test, there was an advance that our foundation drove that now you can do a self-swab, so you could very quickly do the test without having the healthcare worker have to wear protective equipment and having to change that. So eventually we'll have a home test that you can just swab and send back in for the PCR.
So what is the most immediate thing that needs to be done with regard to testing?
Well, you can imagine having a website where you enter in the criteria of your symptoms, are you an essential worker, where you are, and it gives you back a priority level. And so all the testing operations make sure that they're only taking in enough high priority stuff that they can maintain a very quick turnaround so you don't have stale results. That should be reasonable to put together. In parallel, we've got to go as fast as we can on therapeutics and go as fast as we can on a vaccine, because therapeutics can save a lot of lives and avoid the overload. And with luck, some of those will be promising in the next 3 to 6 months. The vaccine is critical because until you have that, things aren't really going to be normal. They can open up to some degree, but the risk of a rebound will be there until we have very broad vaccination. Well,
and you've said it may take, according to the scientists you work with and you talk to all the time, it could take up to 1.5 years to get that vaccine. What are you saying, literally, that it could be the fall of 2021 before Americans can be safe from this COVID-19?
Before you can be completely safe. I mean, by doing the strong social distancing that most of the countries engage with right now, that allows you to level off the cases and bring it down. And you want to bring it down to a level that your capacity to test, to do contact tracing, to make sure the quarantine's maintained, so you don't see a big rebound, even though you've allowed most work to continue, school, certainly in the fall, you'd like to see that go in. So we want to have that period, have the economy not as damaged as it is in this extreme period where the numbers are so big and they've been growing exponentially that we've got to get that down so that it's much lower.
But when you talk about returning to some semblance of normal, what are we saying that looks like? I mean, you mentioned keeping up social distancing. What could life look like say 6 months, a year from now, there's still some of these steps we're taking now, they would remain in effect?
Yeah, I'm working to write about that. The closest model today is you look at China. They are sending people back to work, but they're wearing masks, they're checking temperatures, they're not doing large sporting events, and so they've been able to avoid a large rebound. There are countries like Sweden that aren't locking down quite as much and seeing, okay, do their numbers go up? If so, can you trace back which are the activities that are causing that? We need to learn from all the countries. Our partner, International Health Metrics and Evaluation, is looking at forecasts where they compare the different countries, and then that's helping us to understand, okay, which policies in which countries seem to be working. And so we'll be far closer to normal once we get those case numbers down. But there will be some things where the benefit to the risk, like large public gatherings, may not resume until broad vaccination has taken place.
Meaning conventions, when you say large public gatherings, over 10 people.
Yeah, well, we'll have to figure out how to draw that threshold, and we may even understand age-specific risk at that point. And so having a classroom with 30 young people in it may be just fine because their role in transmitting the disease, we'll understand in the next month or so. It may be so limited that you're far more liberal with young people getting together than you would be with a general age audience.
Couple of questions about the economy. The Wall Street firm Evercore is projecting a 50%, that is 50% drop in GDP this quarter, an unemployment rate of 20%, twice as high as during the financial crisis. They're projecting another 5% drop in the third quarter. And that's before we begin to come back. Is that your assessment?
Well, again, I'm not as deep an expert on that as I am on vaccines. If you had just a 3-month period of extreme shutdown, and then you were able to do a large degree of opening up, that, in the end is the best thing from a medical point of view and an economic point of view. One thing that'll be very tricky, though, is when we open up, people's psyche in terms of their wealth and their willingness to go out and do things has been deeply affected. So even once you fix the supply side by allowing people to go back to work, factories to run, then you'll still have a huge question about the demand side, taking trips, buying new houses, even buying a car. This is very unprecedented. And so although that model you mentioned looks like one of the more negative, the uncertainty is such that it's not out of the realm of possibility.
The continent of Africa is a place that you and your wife Melinda know very well through your foundation. You've done so much work there. How much do you worry about the effect of this pandemic in a place like that when it hits there?
Yeah, sadly, it seems likely at this point that even though the deaths in the developing world have been very small as yet, because not that many people with the disease went there, as moved around in between rich countries, that because their health systems are so limited, because the social distancing is much harder to do where you live in a slum right next to each other, you have to go out to get your food. There isn't the capacity to run the food distribution system with just a small percentage of the workforce like the U.S. has. And so trying to help those countries get their testing capacity up, figure out what tactics work for them that may be different. The kind of social distancing rich countries do may not work. And so how do you tune that? Sadly, I do think that most of the deaths will be in those countries and the most extreme economic pain. They're not able to borrow, 10, 20% of GDP, which many of the rich countries are engaged in that exercise. They just don't have the credit worthiness, the sense that that'll drive hyperinflation would be very strong. So, even though it's super important that we deal with the domestic numbers and get those down, as we think about innovation, as we think about the rest of this year, the suffering in those countries, we also need to be thinking about that and help as much as we can.
Did I hear you say you think most of the deaths will come
in developing countries? Yeah.
And finally, a personal question. You certainly know this issue better than most anybody else, and yet it has shaken a lot of people. It has caused people who are normally, together in their lives to be quite rattled. How do you think you've been affected by this?
Well, I'm deeply shaken. Every day I'm like, are we really in this situation? Wow. There are things like polio eradication that, felt like we were making progress on that. This is going to be an unbelievable setback for that. People are taking the resources that are funded for that and shifting them to this priority. So, who knows where we'll be on those other efforts. We have some great HIV breakthrough drugs that we want to get out into trials. Those trials aren't happening. In fact, the top people who were going to work on that have been reassigned to work on the coronavirus vaccine. So, the foundation is scrambling because it has a lot of the key understandings and relationships to accelerate some of these solutions. But our normal work, is suffering. And, you just look at people who are isolated at home or, overcrowded in their home, or kids who are going to lose 3 months of learning. The amount of pain involved in this thing is gigantic. And, so it's deeply troubling, but we need to still act to minimize all of that.
Well, Bill Gates, we thank you very much for spending the time with us, for talking with us today. Thank you, and we wish you and what you're doing at the foundation the very best.
Thank you.